If I can obviously move away from COVID, could we get a bit more of a rundown with regards to primary care and what this budget is looking at in that area, but particularly in rural and regional areas?
Yep, we'll get Ms. New and Mr. Cottrell's online too, I think. Yeah.
And Ms. Shakespeare might stay for the
Yeah.
Thanks for the question, Senator. So in this budget, the primary care measures total $632.8 million on top of a spend over the last 2 years of approximately $1.7 billion. The biggest part of that was obviously the introduction of telehealth and the permanent telehealth measures, which just since COVID have been worth over $512 million, I think.
That's additional.
Additional, yep. Mm-hmm. The measures in this budget range from a range of measures that go towards allied health, that go towards primary care through GPs, that go towards rural health, that go towards outreach teams from hospitals with allied health specialists as a combined measure between the Commonwealth and state into aged care. It goes to the 10-year plan, which was launched on budget night as well, the 10-year reform primary care plan, that has a range of measures that really lay the bedrock for a 10-year reform process over the coming years. In terms of the rural measures specifically, I might turn to Ms Shakespeare.
So under the Stronger Rural Health Strategy, there have been an additional range of measures overall at a value of nearly $300 million announced in the budget. I'll just run through those quickly.
Yeah, that would be great.
So additional university departments of rural health under the Rural Health Multidisciplinary Training Program. There'll be 2 of those in 2 areas that were sort of missing University Department of Rural Health in our national footprint in Western Australia. So that's $36.2 million. An additional rural clinical school at Charles Sturt University under that same program, $14.8 million. $2.1 million for ongoing support for the National Rural Health Students Network. So these are all measures to increase support, encourage health practitioners training in rural areas. And we've got a lot of good evidence that those investments where we've had positive experiences for people early on in their training, more likely to stay and work in rural locations once they've graduated. And $99.3 million for additional medical school places in rural areas. So that's including an additional 80 Commonwealth supported places that will be tied to rural campuses. So the idea there is to have more of the end-to-end training available for people to do their full medical training in a rural area. There's $1.2 million for mapping collaborative maternity services, looking at what models we've got where there are gaps, particularly in primary care, midwife, GP obstetrician-led models, and also supporting the appointment of a senior midwife in the department to support the chief nurse and the Rural Health Commissioner. And then there's a series of investments in outreach programs, so $33.3 million for the Royal Flying Doctor Service, which is increasing their capacity to deliver primary care services, dental services through outreach, but also supporting replacement of aircraft so over the next 10 years. Care flight funding, $18 million, which will buy a new helicopter and fixed-wing aircraft to provide support for aeromedical transfers in the Northern Territory. Additional funding for a group called Little Wings for hospital flights, additional aircraft again, which will increase their capacity to move sick children across rural New South Wales, Queensland and the ACT. $17.4 million for Heart of Australia for 5 mobile clinics which travel around Queensland providing specialist services. The MRI deregulation measure, which I mentioned previously, so that's providing additional access to Medicare-funded MRI services in MM2 to 7, so large regional centres out to very remote locations. and $4.2 million for an investment in mental health services, so providing 19(2) exemptions so that people who work in rural, remote areas, regional areas for headspace can bill Medicare as well as be paid a salary.
And I should also mention, Senator, there's been a significant investment there too for women's health and particularly in primary care. So the announcement of $16.4 million for GP endometriosis and pelvic pain clinics, along with an endometriosis plan item, management plan item under the MBS.
Yeah, that was my next question, was actually going to be about the endometriosis plan. Can you sort of maybe outline that a little bit more?
Sure. In terms of the endometriosis plan, it's a significant change, $58.1 million of government investment specifically in endometriosis and pelvic pain management. I mentioned the GP pelvic pain clinics and actually working through with the sector around a significant change in the way that we look at earlier diagnosis and treatment of endometriosis in particular.
Yeah.
So the inclusion of MRIs for early diagnosis for endometriosis, an endometriosis management plan, and really lifting the primary care response and early diagnosis and clear pathways for women to seek treatment to what is often an incredibly debilitating condition.
Yeah. And was there something around cervical screening as well, or cervical screening for particularly in Indigenous communities? Cervical cancer?
There is, Senator. So during the pandemic over the last 2 years, one of the things that we've been really focused on is increased cancer screening, and particularly in areas where people may not have been screening as regularly as they would have, given various lockdowns and just the general anxiety of perhaps going to see those screenings.
Yeah.
In terms of cervical cancer screening, there's been significant investment in actually making sure that people are going back to screening programs as a result of COVID. So investment in increasing breast screening, increasing bowel screening rates, but a specific measure around increasing cervical screening rates, and particularly in Aboriginal and Torres Strait Islander women. And you will be aware that there's a new self-collection process for cervical cancer screening as well being introduced that'll take effect from the 1st of July this year, which will allow women who may not have regular access to a GP or health services be able to organise cancer cervical screening for cancer.
Is that like a home test or something that you deliver?
It allows you to self-collect and actually send it into pathology. It'll make a huge difference. I'm
pretty sure every woman sitting around this table is thinking, I'm not sure how you do that yourself, but anyway. and you know what, Dr Murphy, I'm not going to ask you to describe it for us.
There is an instruction manual, and it will make a huge difference for women, particularly in remote and regional and rural areas, but also certainly for women who may have been experiencing intimate partner violence and actually have anxiety in going to a GP and having that test done.
Yeah, okay. Thank you for that. I just wanted to get an update, if I could, and sort of on progress with regards to the stillbirth national plan. I know there's been some work done around miscarriage and recognition there, but there was the stillbirth national plan.
Yeah, we've done a lot of work around the stillbirth action plan, and in particular response to recommendations that had come out of parliamentary inquiries. This budget includes $23 million over the next 4 years for women and their partners and their families who unfortunately experience the tragedy of a stillborn baby. In response to both issues that have come up in parliamentary inquiries, but also in response to talking with the sector, that includes $5.1 million in grants to support women, their partners and their families get specialised support programs if they experience stillbirth or miscarriage. $4.2 million over the next 4 years for hospital to home program, which will provide women and their families who experience stillbirth with intensive individualised support that commences in the hospital but actually sees them through into the community again. $13.7 million to increase the number of stillbirth autopsies and investigations, to provide information on the causes and factors that will help reduce stillbirths in the future, including addressing the workforce shortages As we know, perinatal forensic pathologists are actually in high demand, generally based in the city. So the package also includes transport costs for parents in regional and rural areas to be able to travel to the city to access those items as well.
Okay, thank you. Ms Shakespeare, I realise my time's probably coming to a close now, but I just wanted to clarify, being a graduate of CSU in my undergraduate, where are those, there's a number of CSU, Charles Sturt University campuses, which ones are going to have the additional rural medical programs?
We're just checking that for you, Senator.
Okay.
I don't know if Mr Rocks is online who could answer that.
So while we're waiting for that, I just wanted to clarify another thing with you. With regards to the Royal Flying Doctor Service, that 33 million, that's not the only funding they get though, is it? Is that additional funding from what they get annually? So what do they get annually, normally? Or
It's in the order of 100 million in total with the additional funding.
Yeah.
So we've been funding RFDS for a very long time. So there's ongoing funding to RFDS. That's an additional investment, and that's just over the forward estimates. It's I think nearly 90 million over the 10-year agreement, but it's on top of existing funding, which over 10 years adds up to 990 million. So it's almost 100 million a year.
Yeah. Okay.
Mr Rocks is online, I think.
We've got Martin Rocks online who can answer the question about where CSU's rural clinical school would be based.
Sorry, thanks, Senator. Martin Rocks, Assistant Secretary, Health Training Branch. Senator, just in answer to the specifics around CSU, we have 8 sites as part of the hub and spoke model. They are Mudgee, Parks, Kempsey, Swan Hill, Moorowa, Griffith, Maxwell, Cootamundra.
Okay, so for those of us whose geographies might be a bit pressed, what states are they all in? I got the New South Wales, most of them, but where are the other ones?
And there's some border work around the New South Wales-Victorian border as well, just around Corowa, which is obviously on the New South Wales side of the Murray there, but there's some border work into Victoria as well there.
So what was the breakdown in New South Wales versus Victoria? How many?
So we've got Mudgee, so all the sites, the mini sites, for want of a better term, as New South Wales, but just to acknowledge that the coral work, there will be some in-reach across the border there into Victoria.
Into Victoria as well, okay.
Yeah, so I'll just,
All right. Thank you, Chair.
Thank you.